Hi, ma'am. My name is Loretta Hanma, and I'll be walking you through the process of the surgery you intend to undergo. Most surgery is a specialized technique used to removing skin cancer with the highest cure rate while minimizing the tissue removal. The goal is to completely remove the cancerous cell while making sure the tissue are adversely affected, especially tissue-sensitive area like the face. The benefit of this particular surgery significantly outweigh the demonstrates. The surgery tends to provide a high cure rate for basal cell, seminoma, minimizing the healthy tissue removal compared to a traditional extraction, as well as and offer better cosmetic outcome for the patient face. Most surgery is a safe and effective approach for removing basal cell cinema, especially in a sensitive area like the zygomatory bones. Basal cell cinema is the most common type of skin cancer. It can occur anywhere on the body, exposing the UV radiation, including the face. When the BCC develops on the zygomatic bones, also known as the cheekbone, it is required special concentration due to the bone location and surrounding structures. It can be triggered by a lot of risk factors, which includes sun exposures and sunburn, fair skin, and previously having the disease. Basal cell carcinoma on the zygomatic bone is challenging as it is close to delicate structure of the body like the eyes, the nerves, and the blood vessels. It can also be challenging due to the face being a cosmetically sensitive area and proceeding the anesthesia outcome is crucial. As mentioned earlier, most surgery is a gold standard for BCC on the zygomatic bone due to the precision of the tissue's sparing nature, high cure rate, exceeding 95% in most cases. This specialized surgery will be performed by dermatologists who has undergone additional training and certifications in more macro graphic surgery. These dermatologists are often referred to as more surgeons. The procedure for this surgery involves a series of steps to ensure complete removal of the cancerous tissue while preserving the healthy margin. Here is a breakdown of the main procedure. Local anesthesia. The area around the tumor is numbed with an injection or another local anesthesia agent. Tumor removal. The surgeon uses a scapular blade or punch instrument to remove the visible tumor with a small margin of the tissue surrounding the tissue. Tissue processing. The excised tissue is a process. The excised tissue is then processed in a delicate, more laboratory site. Margin evacuation. A pathologist examines the tissue section under the microscope to identify the cancerous cell at the edge of the specimen. If cancer cells are found at the margin, the surgeon removes another thin layer of tissue the color code color-coded map, repeating step 3 and 4 until clear margin are, are confirmed. This literary process ensures complete tumor removal with minimum healthy tissue sacrifice. Instruments we use for this surgeries include various specialized instruments, which are scapular blade or punch instrument for initial um, tumor removal. The fork clip is used to grasp and manipulate the tissue. Scissors is used for the delicate part to dissect a tissue. Marking pen. Marking pen to create a color-coded map on the tissue. Chrysostat to freeze the tissue. Suctioning. Microscope for examination of the tissue sections. Suction or closure material depending on the chosen wound closure technique. The duration of the surgery can vary depending on the several factors. Size and complexibility of the tumor. Large or more complex tumor may require more extensive tissue removal and processing, leading to a stronger procedure. Number of incision stage. If multiple rounds of the tissue removal are necessary to advise achieve clear margin, the surgery will take longer. Location of the tumor. Tumor are delicate area of the near vital structures may require extra caution and time to dissect for dissection. Concerning your fear of scarring, most surgery aim to minimize scarring by removing only the necessary tissue. However, some degree of scarring is inevitable with any surgical procedure, and the extent can be influenced by various factors. Size and location of the tumor. Larger tumors or those in cosmetic sensitive area may have the higher risk of noticing scarring. Individual healing response. Wound healing varies from person to person, and some individuals are more prone to develop calloid or scar. Proper wound care. Following post-operative instruction dignity, um, including wound cleaning, applying ointment, and minimizing the tension on the wound is crucial for optimal optimal healing and minimizing scar formation. Wound care and scarring formation. Following your more surgery, your doctor will provide specific instruction on the wound care to promote to minimize heal and scarring. This may include keeping the wound clean and dry, applying prescribed ointment and dressing, avoiding a lot of sun exposures to the healing area, minimizing tension on the wound. It is crucial to this instruction careful. It's crucial to follow this instruction very carefully to ensure proper healing and reduce the risk of complications, including excessive scarring. If you have any concern about the wound care or the scar formation, don't hesitate to discuss with them with your doctor. By understanding the procedure and potential risk and importance of proper wound care, you can actively participate in your healing process and achieve all the best outcome. You may have to be wondering about the best time to return to in order to have the stitch removed. Most surgical typically involve stitches that are removed 5 to 10 days after the initial surgery. However, the exact time depends on the several factors. It is crucial to consult with your doctor for specific instructions. Review and discharge instructions on notes provided by your doctor. This often specify the recommended time frame to stitch the removal. Contact your doctor office, then you can confirm with the appropriate time for you to follow up appointment to remove the stitch and address any question or concern you have. Thank you very much for your time, and I wish you speed recovery in your post surgery.